Hello, my name is Eric Manrose. I'm a physical therapist, and I'm also the clinic supervisor here in Plainwell for OMPT specialists. Today I wanted to look at the Redcord workstation, how we utilize this equipment, how we do a quick test for the lower quarter to try to screen and look at some different things for low back, hip, lower extremity. So the Redcord is a great tool that we use. What we like about it is that it's using core and trunk strength with all the testing and exercise procedures. And it's also just a really quick way that we can look at several things at once to see if we can weed out a weak link in the chain. So it's requiring core strength, posture awareness, position sense, just a lot of good things. So today what we're going to look at is a single leg bridge. We have Lena here as our demo. So we'll walk her through that, and I'll kind of talk through some of the pieces that we look at. So first thing we're going to do is we're going to ask Lena to lift her left leg to match the other side, and then she's going to push through her right leg to bridge up as high as she can. So a lot of things working here: hip, core, low back. What I'm looking for is to see if there's hip drop at all. Sometimes there'll be a little bit of asymmetry. Maybe that hip will drop on one side, probably the unloaded side, but that could cue me into there could be a trunk issue or a core issue there, maybe a glute thing too. We're looking to see if she can go through the full range of motion. Lena, you can go down if you'd like. But just that ability to extend up through for that full hip extension is important. Of course, if there were pain, that would cue us into, maybe there's an issue there as well. So a lot of good things that are happening here. Lena, let's have you do that one more time. Raise your leg, extend through that hip. She's doing a great job here. But like I said, sometimes there's asymmetries. We could quickly look at the other side too. We're always curious to see if left looks different than right. And that would cue us in on potential issues as well. Go ahead and go back down, Lena. So a quick test at home to mimic this would be using like a bench or a couch, putting both legs up there, raising the one, unloading it, extending up, comparing side to side. It's not quite the same. We have instability here, so that's an extra challenge in itself, but it's a quick screen you could do at home. If you notice side-to-side differences, hip pain, low back pain, it could just cue you in that there's something going on. If one of these things are an issue for you, please give us a call. We can get you in for a quick screen or consult and maybe work through some of this stuff and figure out what's going on. Thanks for your time.